faculty from 5 healthcare programs collaborated and developed the Interprofessional Geriatrics curriculum. And since then, we have very excitingly grown to 7 programs now. And the Interprofessional Geriatrics curriculum, or IPGC, it is an interprofessional education program for students, and it is delivered in a geriatric community-based facility. And it begins with an introductory session where the students sit down, they meet each other, they develop rapport, and they start to learn about each other's respective professions. And then after that, they actually follow up with 3 sessions with their resident in their resident's actual home, which is a very unique opportunity for us to experience that non-traditional way that healthcare is currently being delivered.
IPGC tries to get students from a number of different professions working together so that they learn about each other, they learn what others can do, they become more comfortable working with people in other professions. It helps break down those barriers that we often have, and helps to build the confidence that any professional knows that there are other people there to help them out when they need assistance.
So our goals really then are to empower students to really be healthcare providers of the future, to really give them skills to work with our geriatric community. We know our aging community in this country is huge, and we really need to provide our students with the tools to work with our elderly community. We really want to help them also learn how to work and get resources and understand the various trainings and resources that all our various professional schools have and need, and so they know how to access those resources later and identify the problems that each of their patients might have and how they can get them the proper care that they need if they themselves can't provide that care.
Coming from an occupational therapy perspective, I believe that one of the greatest challenges is not necessarily understanding everything that the patient is going through. There's a lot of things that came up during the interprofessional geriatric curriculum, such as all the medications that patients may be on, different lifestyles, things like that, that if we can't necessarily speak from experience, might be a little bit difficult to relate to. So that's what really helps in having that full team of care providers working together.
Interacting with the other professionals helped my education a lot. It let me see the importance of what the other professionals do, and just gave me an idea of how to interact with them and questions I could ask.
I would say that IPGC is a great experience, and it's really crucial that USC continues this kind of work to allow students to work together and foster professional relationships as students so that we can continue those relationships as we proceed in the future as professionals.